Dr. Adam Olscamp, orthopedic surgeon. I'd like to talk to you today about acetabular labral tears, what they are and what causes them. Acetabular labral tears are a part of a group of injuries considered femoro-acetabular impingement syndrome. The labrum itself is a form of gasket around the edge of the cup side of the ball and socket joint. This is most often torn in trauma and or some sort of athletic injury, wherein a hyperflexion injury to the hip tears that gasket away from the edge. Patients describe an acute pain in their groin area as opposed to in the lateral aspect of their hip. Then we send them for x-ray to see whether or not they have some form of bony impingement. The next step in evaluation is MRI arthrogram, which allows fluid from the injected contrast to leak up between the labrum and the edge of the acetabulum. Femoral head, acetabulum to the right. As we slice through, you'll note this flattened area is the cam lesion of the femoral head, and this white line through that structure there is the labral tear itself. The labrum is the gasket here. This is the bone of the pelvis, and as we go up, you can see that this one actually has some ossification or bone formation in the labrum tear because it's been present for quite some time. In today's world, we're able to use arthroscopic techniques, utilizing a series of small incisions or portals to place an arthroscopic camera into the distracted hip joint, to place small anchors into the bony edge of the acetabulum and use those to reattach the labrum to the edge of the cup, restoring it to its normal anatomy. It helps to restore lubrication to the joint and, in theory, helps us decrease the wear rate and the potential for developing arthritis down the road. Once the anatomy is restored, we're able to start gradually working on the rehab protocol. That starts off with a 6-week period of non-weight bearing in order to allow the acetabular labrum to heal back to the bony edge of the cup itself. Once we have you fully healed down, we're able to start gradually increasing your weight bearing status to full weight bearing, usually by 7 weeks, gradually progressing to ambulation and subsequent jogging by 8 to 9 weeks. We work on linear activities only for the first 2 to 3 months, and gradually progressing to rotational sporting activities at approximately 4 months. Once again, Dr. Adam Olscamp, thank you very much for watching this short informational video on labral repairs in the hip.